Okay. Good morning, everyone. Today we have a very respectful Dr. Anand from Kolkarni Hospital. So he's very intelligent and very wise in our eye. So he is talking about digital device. Please tell us what is digital device. See, any device which has a screen, where it may be your mobile, it may be your tab, or it may be a laptop or a desktop. Any device which has a screen, even it can be your television. So any device which has a screen, we call it as a digital device. So is it impact on our eyes? Yes, obviously. When your eyes are exposed to any digital device for a prolonged period of time, your eyes are open continuously and the blinking rate comes down. So when the blinking rate comes down, it impacts your eye health. So this is called as dry eye disease. How does prolonged screen time contribute to dry eye disease? See, when, as I said, when you are continuously looking at a monitor, whether it is mobile or a laptop, your eyes are open for a prolonged period of time. And when the eyes are open for a prolonged period of time, the blinking rate comes down. It leads to symptoms like redness, watering, and burning sensation. And this is called as dry eye syndrome. Okay, thank you. What are the common symptoms of dry eyes using a digital device? So as I said, when you are continuously looking at the screen, it leads to burning sensation in the eyes. It leads to watering in the eyes. It can even lead to redness in the eyes. And with in very severe cases, it can also reduce the vision of the patient. So what can we do for? Yeah, so if any patient comes to me with all these symptoms, the first thing what I tell them is to follow the rule of 20. That is, every 20 minutes, they have to look at a distance of 20 feet and they have to take a break for 20 seconds. So, this is called as 20-20-20 rule. This is what I suggest all my patients. And apart from this, we have other treatments like lubricating drops. We also have lubricating gel. And in severe cases, we also suggest something called as eyelid treatment. So, yeah, this will reduce the this will increase the water secretion from the tear glands. Okay. How much time screen time per day is considered excessive in terms of eye health? See, it depends on the age of the patient. For children who are less than 6-year-old, actually they should not use any screen time. And if they are between 6 to 12 years, about 1 to 2 hours is okay. And if they are from 12 to 18 years, about 3 to 4 hours is okay. And after 18 years, if your job requires you to use screen time, you can use it for even up to 12 hours, but you have to take breaks in between. As so I already, yeah. Sorry? What about kids? They are very kids, yeah, that's what I said. The kids who are less than 6-year-old, they are not supposed to use any screen. The guideline. After 6 years old, there is from 6 to 12 years old, it is from 1 to 2 hours. 1 to 2 hours. Yeah. Is it good for them or not? See, if it is required for their studies or for their daily activities, then they can use it. There is no harm in using. But there are certain rules, like as I already said, they have to follow this rule of 20, and they should not stare at the screen continuously. They should take breaks in between. And the position also, where they keep their screen, that is also important. They should not look at the mobiles while sleeping. They have to sit in proper posture. They have to sit on a table and they have to keep it at a distance and then use it properly. Any digital device, it has to be used properly. Okay. Thank you. What preventive measures should be taken while working on digital screen? See, as I already said, first thing is your sitting posture. You should not use the devices while sleeping or while you are sitting on the couch. You should have a proper table. You should have a proper chair, and the screen should be adequately lit, and the brightness should be adequate. It should neither be too bright. It should neither be too less. And the distance between your eyes and screen, it should be at least 14 to 15 inches. But there are lots of people, they are doing a private job. They are continuously using yes. As I already said, if you are above 18 and if your job requires you to use the screens continuously, you can use continuously, but every 20 minutes, take a short break of 20 seconds. Look at a distance. If your screen is here, look outside the window. Look outside more than 20 feet. So, and you blink your eyes, you relax your eyes, take a lot of water, and take breaks in between. So, this taking breaks in between, that will relax the muscles in your eyes. Okay.
What are the effective treatment to manage dry eyes caused by digital screen exposure?
So as I already said, there are various types of treatments. In mild to moderate cases, we usually treat with eye drops, such as lubricating drops. And in severe cases, we also have something called as eye light treatment, which naturally increases the tear secretion from the eyes.
So, is there any other advice you want to give us?
See, first thing is you should try to reduce your screen time as much as possible. Don't use excessive screen time when it is not required. And even if you are using it, you use it in a proper way. You have to use it in a sitting posture. You should not use it while sleeping. And you should also see that you are not in a dark place. You have the room should be well lit.
And those who are addicted to?
Yeah, they should try to reduce their screen time. They should. There's something called as digital detox. Now people are doing it. Like like one day in a week, you try to switch off all your mobile, and before going to bed, I suggest at least 8 o'clock should be the last time when you are seeing your mobile. Yeah. So before 2 hours before going to bed, you should stop using all the mobiles because it even affects your sleep cycle. So if you use it more than after 8 o'clock, there are some certain hormones which are required for sleep. So those hormones are not secreted, and you don't get adequate sleep. So it is very important to switch off all digital devices before 8 o'clock.
It's totally depend on us.
Yes. Yeah. It is in your hands. Okay.
Yeah. So thank you so much, doctor. आपने हमें इतनी अच्छी एडवाइस दी। हमारे को इतनी चीजों के बारे में अवगत करा। Thank you.
Thank you.